This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. This is a routine case where I'd like to demonstrate the classical divide and conquer 4-quadrant technique. And this video is specifically aimed for the beginner surgeons. And as I go through it, I'll be speaking about the ideal settings one has to use at every step. And also a few comments on the most common errors done by the beginner surgeon. The patient is a 52 years old lady, and this is a soft cataract, grade 2 nucleus. So we begin the surgery by doing the 2 side put incisions. The capsule is stained, OVD is placed into the eye, the globe is stabilized, and the triplanar main 2.8mm incision is created. Again, I am stabilizing the globe with my second instrument, which happens to be a lens dialer, and I'm using a forceps to perform a rhexis. In softer cataracts, it's better if we have a slightly bigger rhexis, because sometimes if the nucleus is too soft and mushy, removing it can be a little bit of an issue. I'm aiming a rhexis which is about 5.5mm in size, and I think I got it. Cortical cleaving hydrodissection is performed by lifting up the capsule with the cannula and then injecting a very small amount of fluid. The capsular bag is decompressed. This ensures a complete distribution of the fluid behind the nucleus. The nucleus is rotated just to confirm that all the corticocapsular adhesions are broken. Time to emulsify the nucleus. So to begin with, we're going to use the Epinucleus mode to just aspirate the superficial cortex and the epinucleus. So as expected, our phaco energy would be very less, and maximum would be 5% intorsional. And once the epinucleus and the cortex is taken care of, time to perform the trenches. In this case, I've exposed the tip slightly longer. I believe by doing so, we can get a slightly narrower trench, which is going to be very helpful in the soft cataracts. If you have a very wide trench in soft cataract, it becomes difficult to crack them. So one tip here would be to have a slightly longer exposed tip so that we can reach the posterior plane of the nucleus without the sleeve going in. So that's going to be helpful here. So we begin the first trench. The globe is stabilized with my second instrument, and the tip moves from the subincisional area to the opposite rhexis. And as the nucleus is being rotated for the second trench, let me pause here and show you the settings. The power is 50% continuous torsional, and the flow rate is 12 and the vacuum is 80. Now please note that we have kept the flow rate and vacuum very low. Some of the beginner surgeons are not aware of it, and they keep a high flow rate and vacuum, and that causes a slightly higher risk of eating out the peripheral part of the nucleus and perforating the posterior capsule. So we need to understand that while sculpting, our basic principle is to just eat out the nucleus. We don't want to aspirate anything. So the flow rate and the vacuum have got very limited role. The only role probably is to just aspirate all the lens material which is shaved off. So we're not using any vacuum to hold, nor we are aspirating any fragment. So mind you that the flow rate in the vacuum has to be very low when you're sculpting. This gives us exquisite control when you're trenching, and even in a soft nucleus there is a lesser risk of eating off the fragments and going through and through to the posterior capsule. So this is one trick which can be helpful. I begin the trench, and again in a couple of strokes I reach the adequate depth. The final trench is being done, and as we go to the last trench, the subsequent trenches are going to be deeper. And now looking at the color change pattern, I realize that most of the grooves are adequate depth. Only the central part needs to be stroked one more time, and now we have adequately sized trenches, and now to do the lateral separation. Both the instruments are kept as deep as possible in the trench, and lateral separation maneuver cracks it, and it's a very easy thing. And all the 4 cracks are done. The fragments are free now. Now each of these fragments is then pulled out of the bag. The setting is changed now. So we're going to use a quadrant removal mode to emulsify each of these fragments. So quadrant removal is probably the easiest part of the surgery for most beginners because we are involved in training quite a few surgeons, and what we realize it's better off to start with the quadrant removal stage so that they get used to the foot control, the coordination of the hands, the ear and the foot. So once the quadrant removal is done, the cortex is aspirated out. The planned intraocular lens is placed in the bag, and that's it, the case is done. Now let me go back and review this case and just highlight few more things. How do we assess the depth of the trench in this soft cataract? Well, obviously the classical teaching always is to go ahead and look for the red glow. The red glow might not be visible all the time. So in this case, as I go deeper, we can see the horizontal striations disappearing. Usually the color of the posterior plate is more of a white when we're still not of adequate depth. And once we've got more posterior, the groove becomes much more darker. You lose that white sheen, and underneath you have this faint red glow. These are the pointers which we need to look at. So when this pattern of the horizontal striations disappear, the color changes and becomes slightly more grayish or darker, and that we know that we are very near to the posterior plate. So one has to train our eyes to identify this pattern. This helps us to avoid making the mistake of being too superficial, which is one of the most common errors done by the beginner surgeon. The second tip in this case would be, in softer cataracts like this, try to have a narrower trench which is long rather than a wider trench. If you have a wider trench, you don't get the lateral walls to do the lateral separation. Sometimes it can be too crumbly. So in such situations, try to have a narrow trench, and I believe that if you can expose the tip slightly longer, use a lower power, then probably you may not have a very wide trench. This is one trick which I'm trying to teach to my trainees, and you can just try and let us know whether it works. Now coming back to some of the common mistakes done by most beginner surgeons is, when you're trying to trench, the tip is not always in line with the trench. The tip would be slightly oblong, and as a reason, every time they move, they're going to create a new pathway, and hence the trench becomes progressively wider. This is what we need to avoid. So stick to one direction and avoid the lateral movement of the tip. So this is what makes the trench wider. And the second thing would be, don't push at the nucleus. Use the appropriate power. Stabilize the nucleus with the second instrument while doing the trenching. Learning this technique is extremely important, especially when you are dealing with a mobile nucleus as in mature cataracts. So anyway, the second hand is already there in the eye. Why not make a better use of it by stabilizing the nucleus? Number 3, use adequate power to create the trench. If you're using excessive power, dial it down, and if you're using lesser power, increase it. So after the first 2 strokes when you do trench, your mind has to analyze whether the power which you have set is adequate or not. Start with the lower power and then gradually dial it up. For the lateral separation maneuver, if your trench is of adequate depth, placing the instruments deep down will ensure that you don't require a lot of physical force to separate it. And you can separate it very effortlessly. And lastly, pull the fragment out of the bag and then emulsify at the level of the rhexis margin. So that was it. Thank you for watching and hope you found this helpful.